Drugs that can cause seizures. Drugs that can cause seizures. Welcome to this med safety video about medications that can cause seizures. Seizures are sudden, uncontrolled electrical activity in the brain that can cause convulsions, loss of consciousness, and other symptoms. While many factors can cause seizures, certain medications can also trigger them. In this video, we'll discuss some common medications that can cause seizures and what you can do to reduce your risk. Section 1. Antidepressants. Many antidepressants, especially tricyclic antidepressants, can lower the seizure threshold and increase the risk of seizures. Tricyclic antidepressants include medications like amitriptyline, nortriptyline, and imipramine. However, newer antidepressants like SSRIs, selective serotonin reuptake inhibitors, have a lower risk of causing seizures. If you're taking an antidepressant and are concerned about your risk of seizures, talk to your doctor. Section 2. Antipsychotics. Antipsychotics, which are used to treat mental health conditions like schizophrenia and bipolar disorder, can also increase the risk of seizures. High doses of antipsychotics like clozapine and olanzapine have been known to cause seizures, as well as other side effects. If you're taking an antipsychotic, it's important to work closely with your doctor to manage your dosage and monitor your symptoms. Section 3. Antibiotics. Certain antibiotics can also increase the risk of seizures, particularly in people who are prone to seizures. These include penicillin, cephalosporins, and fluoroquinolones. If you're taking an antibiotic and notice any symptoms of a seizure, such as convulsions or loss of consciousness, seek medical attention immediately. Section 4. Antihistamines. Antihistamines, which are used to treat allergies and cold symptoms, can also increase the risk of seizures, particularly in children. Diphenhydramine, also known as Benadryl, is a common antihistamine that can cause seizures in high doses or when taken with other medications that lower the seizure threshold. If you're taking an antihistamine and are concerned about your risk of seizures, talk to your doctor. Section 5. Pain medications. Finally, certain pain medications can also increase the risk of seizures. These include opioid painkillers like oxycodone and hydrocodone, as well as nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen. If you're taking a pain medication and notice any symptoms of a seizure, such as convulsions or loss of consciousness, seek medical attention immediately. In conclusion, many medications can increase the risk of seizures, including antidepressants, antipsychotics, antibiotics, antihistamines, and pain medications. If you're taking any of these medications and are concerned about your risk of seizures, talk to your doctor. They can work with you to adjust your dosage or switch you to a different medication that has a lower risk of causing seizures. Remember, it's always better to be safe than sorry when it comes to your health. Thank you for watching this medication safety video. You can also support the Global Medication Safety Campaign by hitting that subscribe button. By subscribing, you'll be the first to know when we upload a new content on medication safety or alerts.